Dear Michael Krone, dear colleagues, thank you for this opportunity to address you on the first day of your conference. Доброе утро всем русскоговорящим. There had been much good news in the last decades about HIV/AIDS. Globally, falling incidence and mortality in many of the worst affected parts of the world, great progress on treatment with more than 60% of those needing treatment now receiving it. But while we celebrate this success, in Eastern Europe and Central Asia, we see continuous growth of the epidemic in prevalence, incidence, and mortality. Coverage of and investments in prevention remain by far inadequate, placing hundreds of thousands of people at immediate risk and the global response under threat. The epidemic in the region remains largely driven by unsafe drug injection. It is intertwined with the epidemics of tuberculosis, multi-drug tuberculosis, and hepatitis. Increasing numbers of heterosexually transmitted cases are also reported, and clearly, as sexual risks intersect with risks related to present or past injection use, the potential for further expansion of the epidemic is increasing. Legal frameworks that criminalize drug use, sex work, same-sex relation, or that prohibit effective interventions such as methadone compound the risks and contribute to the epidemic's growth. Stigma is high. Combined with discriminatory laws and policies and hostile law enforcement practices, it is a major barrier to access to services for those most at risk. Prisoners are a particularly vulnerable population in the region. An increasing attention is now brought to the high vulnerability to HIV and TB of labor migrants in a region that represents one of the largest migration corridors in the world. Migrants work in either legal or illegal environment for short or long periods of time in countries with hardly any, if no, access to HIV and TB services. All of these elements combine to create a highly toxic environment for responding effectively to HIV/AIDS in this region. And they exist against a background of economic disparities within countries between the rich and the poor. So we have still so much to do to ensure that the tremendous programmatic knowledge we have about how to respond to the concentrated epidemic is disseminated and translated into national strategies, plans of action, and appropriate budgetary decisions. We must take great care, however, that our focus on treatment, including on treatment as prevention, while tremendously important, is not misunderstood or knowingly misinterpreted and doesn't come at the expense of the vital prevention work that we still have to do, not least in the region. We need to better leverage the authority and the credibility of the scientific and medical community in the region to communicate more powerfully at the political level. We need to do more to find common ground between politicians, public health practitioners, law enforcement officials, and civil society. Such a dialogue must surely be guided by greater compassion for people, a belief in their value as human beings, as well as their ability to contribute to society, and a better understanding of the social and economic drivers, for example, of drug use. We need to equip the politicians, the public health and law enforcement officials who are prepared to think differently with the tools and the information they need to make the case for new approaches within their institutions. In the health sector, we have to link specialized AIDS care with primary health and social services, and we need to build support for community and peer-based services, recognizing once and for all that these are a key component of healthcare delivery. Working to increase the health and rights literacy of patients, people who use drugs, sex workers, and other at-risk groups and their networks is also most important. We need to maintain the international leverage and dialogue. We must do everything we can to ensure, however, that our language and our actions within the region and outside it do not contribute to further isolating the region and worsening its epidemic. And finally, we need to remain positive, even in the face of daunting challenges. This means recognizing progress where it is happening, having faith in the people of the region, and remaining confident that if they do what needs to be done, their fight against AIDS can ultimately be won.